likelihood that a person who is not treated will end up with cirrhosis of the liver? It's about 10 to 20%. So a person who has hepatitis C, about 10% will clear it on their own. Their own immune system will fight off the virus. And this is why it's very important to get assessed. Because again, in my practice, almost every month, I'm able to tell someone, you've got the antibody, but your immune system was able to fight off the virus. So about 10% of people with their own immune system will fight off the virus. About 30% will go on to develop significant liver disease like cirrhosis, like liver cancer, like end-stage liver disease. About 30% will have relatively mild disease, and they can carry on with their day-to-day activities. One of the symptoms that some people may experience may be chronic fatigue. Some people may experience some kidney problems, some experience some skin problems, but those are about 5 to 10%. About roughly 2 to 3% per year may go on to develop cirrhosis. Liver cancer starts developing after a person has developed cirrhosis. If one has hepatitis C and has the hepatitis C virus, the chances of developing cirrhosis are higher. If one has hepatitis C and takes more than an average of 2 to 4 ounces of alcohol per week, the chances of developing cirrhosis are higher and quicker. And it takes about an average, if one has not been treated, 20 to 30 years to develop cirrhosis. So I always say, get tested, because you may, until you develop cirrhosis, you may have no symptoms. And once cirrhosis develops, that's when most people might start experiencing some of the complications and the symptoms.
Our health system doesn't recognize hepatitis C as a chronic disease when people's livers or gallbladders and everything are shutting down. Why is that?
Again, the question is, why is it that hepatitis C is not recognized as a chronic disease? Again, I don't know the answer, and it is considered a chronic condition, to the best of my knowledge. The question is, after treatment, the abdomen started swelling. Is it related to fluid? And the best way to have that assessed is, again, by the clinician. And there's a test we can do. We can do the ultrasound. We can do a clinical exam to see whether there is fluid or not. And again, it's important to recognize that about 30% of people who are treated have not responded with a cure. It all depends on when the treatment started and the genotype. However, the treatment slows the progression of the disease down, and I strongly encourage one to then consider being reassessed for the newer treatment regimens. Question? Okay, the question is, I was diagnosed 18 years ago, is that too late? It's never too late to get assessed, because, again, on average it takes about 25, 30 years before one develops cirrhosis. So, if one likely acquired the disease 18 years ago, maybe there's about a stage 1, there's about a 30% chance that it will still be mild. And about a 30% it could be moving towards severe disease, stage 2, stage 3, stage 4. So it's never too late to get that assessment, and it's never too late to consider treatment. The only time I would be very wary to treat with the current treatment regimen is anyone who actually has cirrhosis and the complications like the swelling, like the jaundice, like having had a big bleed. Because in those situations, there's a likelihood of the disease getting worse. However, it's very important to know that we can manage those conditions. And if a person starts having problems associated with the liver, lots of those we can manage. If there's swelling in the abdomen, swelling in the feet, we can give treatment to lessen the consequence of those, and we can continue to manage people who have these complications. So it's never ever too late to get that assessment. How do I feel about liver cleanses and vitamins, etc.? There are lots of, it's very important to have a healthy diet, and nutrition is very, very important. However, it's also important to recognize that there are many fads out there, okay, and it's a buyer beware, quotes unquote, business. So eating healthy, having a healthy lifestyle, very, very important. The cleanses, etc., one has got to be very careful. And in many respects, it can do more harm than good. Okay? So I would be very cautious about, those situations, but I'm an advocate for healthy nutrition. Check the Canada Food Guidelines. Eat healthy, stay active. Vitamin E is very good. It's shown to be very good. Vitamin D. Especially on the course of treatment, I usually recommend vitamin B12 and folic acid to help to build up the blood cells. No, all of those, they have a place, but again, it's done in a context, a whole healthy lifestyle. Yeah, okay, the question is those who have gone undetectable with treatment. Okay, that is the aim of the treatment, to go undetectable. The tests that we have, they are not absolute. It's not black or white. The virus, the tests that we have can detect up to a certain level of virus. Below about 10, it cannot accurately say it is 6 or 7 or 5 or 4. So it usually says it's undetectable. Now, about 10 years ago, the test could detect as low as 50. Then it went to 40. Then it went to 35. Now it's about 10. So what we usually say is that you get the test done, you've had the treatment done, and we expect that after the treatment is completed, there should be no virus detected in the blood. We do the test at the end of treatment. In fact, we do it 4 weeks into the treatment. And anyone who has had a good response by 4 weeks, in other words, the virus is undetectable, they usually have about a 90% chance of a cure. At the end of treatment, we do the test, and then 6 months after the treatment, we repeat the test again. That's HCV, RNA. If that test is undetectable, there's about a 99% chance that that is equivalent to a cure. So the lab will never say there's no viruses, it'll say no viruses undetectable. So what we're going to do, we're going to repeat that test probably in another 6 months and then about another year. And if we have then repeated it 2 or 3 times and it is still undetectable and the liver enzymes are normal, then that is consistent with a cure. Because when studies have been done over the long period following people, and I have done some of those studies, over 10 years or so, once the virus is undetectable at about a year, it's almost 100% likelihood that it's not coming back unless one has got reinfection. So for all intents and purposes, an undetectable lab result 6 months after the treatment has been completed, the recommended treatment has been completed, can be considered a cure. We never used to use the word cure, but we can. You've had measles, you've been cured. With Hep C, you can say, I've had measles and I have been cured. 6 months after the test, after the results have come back and said undetectable. If they're cured, can they go out and drink alcohol? If you want to make Labatt's rich, that's fine. In moderation. Anything in moderation, right? Now the issue is alcohol is still the most common cause of hepatitis and cirrhosis. Thank you very much for this opportunity to talk a bit about a subject near and dear to my heart.